Hello nanas. In this video I'm going to teach you about the anatomy of the thyroid gland. Thyroid gland is an endocrine gland. There are actually 7 endocrine glands in our body and thyroid gland is one among it. It weighs about 25 to 40 grams. It is larger in the females than in the males. Its size further increases during pregnancy and menstruation. I'll now tell you the parts of the thyroid gland. It has a right lobe, a left lobe, and these two lobes are connected with the lower part by an isthmus. Sometimes a third lobe called the pyramidal lobe. This is the pyramidal lobe. A pyramidal lobe may be seen extending upwards from the isthmus or either of your lobes. I'll tell you again. It has two lobes, a right lobe and a left lobe, and then an isthmus and a pyramidal lobe. We'll now see its situation. The thyroid gland is situated in the lower part of your neck. It has trachea beneath it. See that this is your trachea. The thyroid gland is situated in such a way that it embraces the upper part of the trachea, and then you will have your thyroid cartilage here. Remember, I am teaching you about the thyroid gland and this is your thyroid cartilage. Don't confuse. And your cricoid cartilage will be here. So this is your thyroid cartilage, this is your cricoid cartilage, and this is your trachea. This is the situation of the thyroid gland. I'll tell you the extension. The thyroid gland is situated against C5, C6, C7 and the T1 vertebra. The lobe extends from the middle of the thyroid cartilage to the 4th or 5th tracheal ring. See, middle of the thyroid cartilage to the 4th or 5th tracheal ring, and then the isthmus extends from the 2nd to the 4th tracheal ring. Okay, I'll tell you again. It lies against the C5, C6, C7 and T1 vertebra. The lobe extends from the middle of the thyroid cartilage to the 4th or 5th tracheal ring, 4th or 5th tracheal ring, and the isthmus extends between the 2nd to 4th tracheal ring. The thyroid gland contains two capsules. Okay, there are two capsules surrounding the thyroid gland, a true capsule and a false capsule. The true capsule is due to the peripheral condensation of the connective tissue of the thyroid gland, that is, the lobe contains connective tissue. Okay, the periphery of this connective tissue gets condensed and therefore it forms a true capsule. See, so this is your true capsule surrounding the gland, and you will have a rich capillary plexus beneath this capsule. Okay, a rich capillary plexus beneath this capsule. Therefore, this is your capsule, this is your capsule, this is your capillaries and the thyroid gland. Therefore, to avoid hemorrhage during the thyroid surgery, the gland is removed along with the true capsule. Okay, and then we'll go to the false capsule. The false capsule is derived from the pretracheal layer of the deep cervical fascia. Okay, pretracheal layer of the deep cervical fascia. It is thin on the posterior borders and it is thickened on the inner surface to form the suspensory ligament of Berry. Okay, actually this layer is thickened inside the gland and it forms a ligament called suspensory ligament of Berry. Suspensory ligament of Berry. Okay, and then it then attaches them with the cricoid cartilage. We have seen, no, here will be your thyroid cartilage, here is your cricoid cartilage, and here will be your trachea. So this suspensory ligament of Berry will attach the lobe to the cricoid cartilage present here. So this is about the capsule, a true capsule and a false capsule. True capsule is due to the condensation here, condensation in the periphery of the connective tissue of the gland. False capsule is derived from the pretracheal layer of the deep cervical fascia. We'll see the parts of the thyroid gland in detail. First, we'll see about the lobe, okay, each lobe, okay. The lobe contains an apex and a base. See, this is your lobe, okay. So, it has apex here and the base here. And then the lobe has three surfaces. See, consider a triangle. This is how the lobe looks like when you see it in the cross section, okay. So, it is triangular. It has three surfaces. Your posterior surface here, your lateral surface and the medial surface, okay. Posterior surface, lateral surface and the medial surface. And you will have two borders, an anterior border and the posterior border. So these are the parts of the lobe: an apex, a base, three surfaces, posterior, lateral, medial, and then two borders, anterior and posterior border. We'll see the relations of the apex and the base now. The apex is limited by the sternothyroid muscle, okay. It is limited by the sternothyroid muscle, and then it is related with the external laryngeal nerve and superior thyroid artery, okay. External laryngeal nerve and superior thyroid artery. Now the base. The base is related with the fourth or fifth tracheal ring, okay. It is limited by the fourth or fifth tracheal ring, and the base is related with the recurrent laryngeal nerve and inferior thyroid artery, okay. Recurrent laryngeal nerve and inferior thyroid artery. Remember, always the external laryngeal nerve and superior thyroid artery goes together, and the recurrent laryngeal nerve and inferior thyroid artery goes together, okay. The apex is related with this and the base is related with this. So, moving on to the surfaces, the lateral surface is related with four muscles. They are sternothyroid, sternohyoid, superior belly of the omohyoid, okay, superior belly of the omohyoid, and the anterior border of the sternocleidomastoid. These four muscles overlaps the lateral surface, okay. To the medial surface, it is related with two tubes, trachea and the esophagus, and then two muscles, inferior constrictor of pharynx and the cricothyroid, and two nerves, your recurrent laryngeal nerve and external laryngeal nerve, okay. And then the posterior surface, it is related with the carotid sheath, okay, carotid sheath. I'll repeat, the lateral surface is related with four muscles, sternothyroid, sternohyoid, superior belly of the omohyoid and the sternocleidomastoid. The medial surface is related with two tubes, trachea and esophagus, two muscles, inferior constrictor of pharynx and the cricothyroid, and then two nerves, recurrent laryngeal nerve and the external laryngeal nerve. And the posterior surface is related with the carotid sheath. You will also have your common carotid artery on the posterior surface. So, this is about the surfaces. I'll tell you about the borders of the lobe, an anterior border and the posterior border. The anterior border is related with the superior thyroid artery, and the posterior border is related with inferior thyroid artery, and then An anastomosis occurs between the superior thyroid artery and the inferior thyroid artery. This anastomosis occurs on the posterior surface. And then you have your parathyroid gland. Parathyroid gland is also an endocrine gland, and it is very important regarding the calcium metabolism. So you'll have your parathyroid glands and the thoracic duct. Okay, the thoracic duct is seen only on the left side. So these are the relations with the borders. The anterior border is related with the superior thyroid artery, and the posterior border is related with inferior thyroid artery. And anastomosis between the superior and the inferior thyroid artery, parathyroid glands, and the thoracic duct only on the left side. So this is about the lobe. Okay, the lobe has an apex, a base, three surfaces: posterior, medial, lateral, and then two borders, anterior and the posterior borders. We will now see about the isthmus in detail. Okay, so the isthmus has two surfaces, an anterior surface and posterior surface, and then it has two borders, a superior border and an inferior border. See, it is somewhat a rectangular in shape roughly. So it has two surfaces, an anterior surface and the posterior surface behind, and then two borders, a superior border and the inferior border. Okay, now the anterior surface is overlapped by sternothyroid and sternohyoid muscle on both the sides. Okay, so here sternothyroid, sternohyoid both on the left and the right sides, and then you'll have your anterior jugular vein, and then it is covered by the fascia and skin. Okay, sternothyroid, sternohyoid, anterior jugular vein. You have the fascia and skin covering the anterior surface, and on the posterior surface we have already seen, no, the trachea is situated deep to the gland, which means that it overlaps the second to the fourth tracheal ring. So this is what the posterior surface is related with. Okay, the anterior surface is related with sternothyroid, sternohyoid muscle, anterior jugular vein, fascia, skin, and the posterior surface is related with the second to the fourth tracheal ring. We will now see the arterial supply of the gland. It is supplied mainly by two pair of arteries, a superior thyroid artery and inferior thyroid artery. The superior thyroid artery is a branch of the external carotid artery. Okay, it is actually the first branch of the external carotid artery, and the superior thyroid artery accompanies the external laryngeal nerve. We have seen, no, superior thyroid artery always goes with the external laryngeal nerve. So this is your gland. Okay, we have also seen this already. This superior thyroid artery will reach the upper pole of the gland, and it divides into two branches, an anterior branch and the posterior branch. The anterior branch will move along the anterior border of the lobe and the superior border of the isthmus to anastomosis with its fellow from the opposite side, and the posterior branch. The posterior branch will descend down on the posterior border and it anastomoses with a branch, that is an ascending branch from the inferior thyroid artery. Okay. Next is the inferior thyroid artery. Inferior thyroid artery is the branch of the subclavian artery. Okay, the subclavian artery has many branches, of which one is the thyrocervical trunk, and from this thyrocervical trunk your inferior thyroid artery arises. It accompanies the recurrent laryngeal nerve. We have also seen this, that the inferior thyroid artery always goes with the recurrent laryngeal nerve. So this inferior thyroid artery reaches the gland by dividing into 4 or 5 branches. Okay, it divides into 4 or 5 branches, and then it reaches the lower pole of the gland, of which one ascending branch will anastomosis with the posterior branch of the superior thyroid artery. So The superior thyroid artery and the inferior thyroid artery are the main supply. Sometimes you have lowest thyroid artery. Okay, the lowest thyroid artery is seen only in 3% of the individuals. Okay, it arises from the brachiocephalic trunk or the arch of aorta directly. Okay, arch of aorta directly. So this is the lowest thyroid artery, and then you have accessory thyroid arteries. Okay, accessory thyroid arteries are the branches of the tracheal and the esophageal arteries. Okay, so it is supplied by superior thyroid artery, inferior thyroid artery, lowest thyroid artery in 3% of the individuals, and the accessory thyroid arteries. This is about the arterial supply of the thyroid gland. Okay. We will now see about the venous drainage of the thyroid gland. It is actually drained by superior thyroid veins, middle thyroid veins, and the inferior thyroid vein. Okay. The superior thyroid vein emerges from the upper pole of the gland. Okay, it emerges from the upper pole of the gland and it drains into the internal jugular vein. The middle thyroid gland emerges from the middle of the gland and it also drains into the internal jugular vein. The inferior thyroid vein emerges from the, see, you have your isthmus here. So the inferior thyroid vein emerges from the lower border of the isthmus and it drains into the left brachiocephalic vein. Okay, brachiocephalic vein. Sometimes another vein called a fourth vein. Okay, fourth thyroid vein. They emerge between this middle thyroid vein and the inferior thyroid vein, and it also drains into the internal jugular vein. So there are actually mainly 3 pairs of veins, and sometimes the fourth thyroid vein is also seen. Okay, they are the superior thyroid veins, middle thyroid vein, inferior thyroid veins, and the fourth thyroid veins. They drain the thyroid gland. We'll see the lymphatic drainage of the gland. The upper pole of the gland, okay, the upper pole of the gland drains into the upper deep cervical lymph nodes. Okay, cervical lymph nodes, either directly or through the pre-laryngeal nodes. And the lower part of the gland drains into the lower deep cervical lymph nodes directly and also through the pretracheal and paratracheal nodes. Okay, so the lymphatic drainages are upper pole of the gland drains into the upper deep cervical lymph nodes. Lower part of the gland drains into the lower deep cervical lymph nodes. This is about the lymphatic drainage. Next, we'll see about the nerve supply. It is mainly from the middle cervical ganglion. Okay, there are actually 3 cervical ganglion: superior, middle, and inferior. It gets supplies from also these ganglion, superior and inferior, but it is mainly from the middle cervical ganglion, and they are vasoconstrictor in nature. Okay, they are vasoconstrictor. So this is about the nerve supply. We will now see about the histology of the thyroid gland. The thyroid glands are arranged in follicles. See, they are arranged in the follicles, and then you'll have your connective tissue here. Okay, the follicles are lined by cells. These cells are called as the follicular cells. Okay, they are secretory in nature. They are the follicular cells. They secrete triiodothyronin and tetraiodothyronin. Okay, these are the actual thyroid hormones, triiodothyronin and the tetraiodothyronin. They are secreted by the follicular cells. Okay, during the active phase they are columnar, and during the resting phase they'll be cuboidal. And also you have another type of cell called the parafollicular cells. Okay, you'll have your parafollicular cells in between your follicles. See, consider this as the cells. You'll have the parafollicular cells between the follicles and also within the follicles. Okay, these parafollicular cells are also called as the C cells. They are also called as the C cells. They secrete the thyrocalcitonin. That is why they are called as C cells. They secrete thyrocalcitonin. And then you have your connective tissue here along with capillaries. Okay, so the thyroid gland is arranged in follicles. It is lined by the follicular cells which secretes the triiodo and the tetraiodothyronin. In between the follicles and within the follicles you'll have the parafollicular cells or the C cells. They secrete the thyrocalcitonin. So this is the histology. We'll see the development of the thyroid gland. Okay, the thyroid gland develops from a structure called median endodermal thyroid diverticulum. I repeat, it is median endodermal thyroid diverticulum. So this is your diverticulum. Okay, the lower end of the diverticulum enlarges to form the thyroid gland. Okay, so this is the thyroid gland, and the remaining part of the diverticulum remains narrow, and this is called as the thyroglossal duct. So this is the thyroglossal duct, but this duct will soon disappear. Okay, the diverticulum's upper end is marked as the foramen cecum of the tongue. While we learn about the tongue, we'll see a structure in the tongue, that is the foramen cecum. Okay, this is actually the result of the diverticulum, and the lower end will persist as the pyramidal lobe. We have seen in the parts, no, there will be pyramidal lobe. So the lower end persists as the pyramidal lobe, and the upper end persists as the foramen cecum. This thyroglossal duct will soon disappear. Okay, it will disappear, but in some cases it will not, and it will form the thyroglossal cyst or the fistula, which is a pathology, and it may require surgery. So this is about the development of the thyroid gland. It is developed from the median endodermal thyroid diverticulum. Okay, the lower end enlarges to form the thyroid gland, and the diverticulum will soon disappear. So this is about the development. So this is all about the anatomy of the thyroid gland. We have seen the basics of the thyroid gland, its parts, capsules, its parts along with the relations, and then the arterial supply, venous drainage, lymphatic drainage, nerve supply, histology and embryology. So in the exams, if they ask you in an essay, you have to write all about this. And a tip to you is draw as much as possible. Okay, not only in anatomy, in all the subjects, draw. Just try to represent everything in the figure rather than writing for many pages. Okay, so this is a hint, and so this is about the anatomy of the thyroid gland. I hope this video was useful. So I want you to like, share and subscribe my channel. Thanks for watching.